What is sciatica, right? So many times patients will come in with an already, preconceived notion, oh, I have sciatica because of this, that, or the other. But sciatica is compression irritation of the sciatic nerve. There are many things that will mimic it, but it's not always sciatica when there's pain in the leg or the buttocks. And getting the proper diagnosis is so important. I'm going to use a cough as an example. Two individuals have a cough. One has pneumonia. One is choking on some popcorn. They both have a cough, but the treatment protocol is very much different for the same type of symptomatology. So when we look at sciatica, understanding what it is super important. The first thing we want to know is that sciatica is from irritation on the sciatic nerve, and the sciatic nerve is from the lower back and the sacrum. It has components that go down the leg below the knee, and below the knee is a really important component. Many times sciatica is misdiagnosed. It might be diagnosed as sacroiliac pain, sacroiliac pain might be misdiagnosed as sciatica. Hip pain, there might be lumbar pain, myofascial pain syndrome, gluteal syndrome, or even a piriformis syndrome can all mimic sciatica. Now, these areas can also create irritation to the sciatic nerve, but they're separate and distinct, and the treatment protocol is very much different for each. Right? So the first thing we want to do is not have a misdiagnosis. And this is not sciatica. This is a sclerotomal pain syndrome problem. And I want to turn the camera just a little bit here. And sciatica is something that has a component down below the knee. Now, can sciatica not be down the knee? Occasionally, but generally speaking, when you irritate the nerve enough to create a sciatic component problem, you're going to see problems down below the knee. Right? There are different causes of sciatica. The piriformis can irritate the sciatic nerve. You can have a bulging disc. There could be stenosis. There could be arthritis. There could be, hard bone on soft nerve misalignment. There are all sorts of things that can, but the proper diagnosis is key. And when we talk about the proper diagnosis, we want to be able to differentiate, is it piriformis syndrome? Is it sciatic from a disc? And then how do we go about treating that? Now, the treatment process is really a three-step procedure. The most effective way to treat is, one, we have to have a proper diagnosis. Two, we want to have an appropriate treatment protocol. And then three, we want to prevent relapse, right? So the first thing is, let me turn this a little bit more so you can see that. There we go. So the first thing is, a proper diagnosis. What are we going to do as far as the diagnosis is concerned? We want to have somebody who's proficient in the use of imaging. CAT scans, MRIs, CT scans. Do you know how to order them? Do you know how to read them? Do you know even what they're used for and when to order them? And then we want to also have clinical skills and physical assessment to determine what is the cause and what isn't the cause, and then an ability to differentiate between different diagnoses so that you can do the appropriate treatment protocol or the appropriate treatment, right? So this is, you want to have somebody who's has clinical skills to know how to intervene and the type of intervention that's most appropriate. Are we going to use, this technique, this approach, that approach? We also want to have somebody who has the ability to recognize condition change. Sometimes during treatment, the condition will change enough that it's something entirely different that needs to be addressed instead of the original problem. And then we also want to use somebody who has experience with similar problems, somebody who has a long track record of treating something like this. And then lastly, we're looking for step 3, which is how do you prevent a relapse or a reoccurrence? What are some lifestyle interventions? How can we, change the way that the body is moving and functioning? What are some, appropriate strengthening exercises? And how can we avoid aggravating behaviors so that the problem doesn't come back? And this is something that we do in the office every day. I've been treating sciatic type problems since the 90s. I'm on, over 25 years now. And it is something that does take a good steady hand.